Hi, I'm Nicole Montoya, and I'm a physician assistant and also here as the director of marketing. I have a background in both clinical practice as well as sales and marketing, and I came to CIC because they have a unique model for caring for their patients. Basically, that means that we have the opportunity to do multiple different service lines that treat our patients in a flexible, timely schedule. We treat them in a non-intimidating environment because we're outside of the usual hospital scenario, and the patients really seem to enjoy coming here for their care. The thing about working at comprehensive interventional care that makes me the most excited to be part of the team is the quality of care providers that we have here, the direct interaction with the patient, the multiple levels of service that we provide that are very specialized, and the fact that we can provide an overall experience that's very positive if you have to have some kind of high-level procedure. Here is different because we're outside of the usual hospital environment. All of our patients can come in and be treated on a really flexible schedule, and we can usually get them in within a couple of days of their referral being requested. They don't have to stay overnight. We are able to recover them with a full service nursing team, and they can go home the same day, which is really beneficial, especially if they're traveling from outside the area. We get a lot of patients that don't live nearby, so that makes it easy for them to come in and get treated and then go home. So we are trying to interact with our patients to give them the option that we will cover all of their care needs, essentially. They get sent to us from a primary care provider or another provider for a specialty service, which we offer, and we try to make that as easy for them as possible. We provide support to get through their insurance questions and pre-authorize the procedures that we do, which sometimes can be arduous for the patient or the office that's sending them. We keep them in an easy environment for them to spend the day in with lots of caregivers supporting their experience, and they get to go home same day. After that, we do a lot of communication back to their primary physician or whoever sent them to us so that everyone's aware of the treatment plan. And then we have a really set schedule for when we want to follow up so that we don't lose them after their treatment, and we can support them through that whole recovery process. One of the things that's really important to us here is treating our patients as if they were part of our family. Our staff is really family. Everyone here knows each other both inside the practice and outside and spends time together, and I think everyone has the awareness of how they would like their family member, their mom, their aunt, their brother to be treated if they had to come into an environment for a specialty procedure. So we offer that kind of dynamic so everyone feels comfortable while they're spending time with us. CIC is a unique practice because the specialty physicians that we have here, most of them have known each other in other scenarios, other hospital environments, other practice environments, and all of them have specifically chosen to come and work together here as a team. I think it's very unique to have a group of physicians and other providers like nurse practitioners, PAs, nurses, techs, that all have some background working together, and they come here to provide a high level of service because they came from an environment where they knew they could add more value in the setting. So I think that is a unique scenario that we find here. So I've worked in environments, 20 years in hospital environments, both on a clinical side and also as a vendor interacting with accounts in multiple states and locations. So it's very interesting to be in the CIC environment, comprehensive interventional care environment, where we have also multiple geographies that we're interacting in, lots of different patient demographics. I think the unique qualities that we see is that we're in an outpatient environment. It's a lot less cumbersome for the patient and the referring physician to get their patients into this scenario versus having to send them through the hospital systems. And just the whole process for the healthcare experience is streamlined because of that model. The thing about working at comprehensive interventional care that makes me the most excited to be part of the team is the quality of care providers that we have here, the direct interaction with the patient, the multiple levels of service that we provide that are very specialized, and the fact that we can provide an overall experience that's very positive if you have to have some kind of high-level procedure.